and thanks for having me. The network I'm going to talk about is named the New Healthcare Puzzle, and the name was chosen with the idea that different companies and institutions would bring in different parts of the puzzle and create something new for the German healthcare system. That is the background. And what I'm presenting here is that are not my own views and not related to to the company Janssen and Johnson. Both are funding members of the network and currently working on a corona vaccination as well. But I'm just independent here now, talking about the healthcare puzzle. So the group is quite diverse. And from technology companies like SAP, they are a member here, or Siemens Healthineers, to research organizations like Fraunhofer, or even the Hasso Plattner Institute in Potsdam. That was an important founding partner in 2014 when we started. Telekom and RTL brought in different viewpoints on the healthcare system, for example, telemedicine or healthcare education via the TV. And we started with 14 partners. We added several new companies during the last few years, mainly startups like MDoc or Umedi, or most recently Cru, and the first purely digital health insurance, Autonova. Pharma and medtech companies are represented by Janssen and Johnson & Johnson, but for instance, Philips is part of the group as well. During the last few years, we lost some of the partners due to different focus, or just when the enthusiasts left the company. So the group is not only very diverse, but also living, and I think that's an important thing. In 2014, for example, there was no digital health insurance, for example, or we lost a startup that went out of business. But I think that's important to have a living group. So what are the common goals of the network from the start? We wanted to establish good and trustful contacts, combine the skills of the different partners, and establish real partnerships, and finally explore opportunities for working together on projects and finally do business together. And exchange and networking has been quite important from the beginning. Understanding the different business models of the different companies, of tech companies versus research-oriented pharmaceutical companies. It was about learning from each other and finding out where common ground is, or where things can be done together. And for example, we learned from Philips about their incubator, Health Innovation Port, that's located in Hamburg, a very nice location, and found out that they are working on platforms for patient-reported outcome. And that's something we might have missed without this group. And now we are discussing how to work together in this field. And after a while, working on several newly developed projects, we began to make use of the whole group as a sounding board. So partners brought in their sometimes difficult projects or ideas and pitched them to find partners, or getting support from the group. For example, Telekom and Fraunhofer found together, based on common interest in a secure health data space. And Janssen worked with Telekom and Fraunhofer on a telemedicine project in the field of oncology. So from the beginning, and our first meeting was, as mentioned, at the Hasso Plattner Institute, we used the design thinking approach for most of our meetings. In general, we organize our gatherings at different locations of our partners. For example, here you can see the app house of SAP in Heidelberg. And we used the Fraunhofer Forum in Berlin. or the design studios of Hive in Munich, where we, for example, we had the opportunity to test several prototypes. Most recently, we met at the Telecom Design Studios, Telecom Design Gallery in Bonn, where we had a special guest, Eckhard von Hirschhausen, who joined us just based on his interest in digital health solutions. This is an example, again, agenda that I would like to share now, but it doesn't work. That's an example agenda. Various projects have been presented and discussed, from big data approaches to a telemedicine project for rural areas where no doctor is available, the practice without a doctor. It has been realized now by Tobias Gantner from the Healthcare Futurist, but even without the involvement of the Healthcare Puzzle Group, but an interesting and very important project, I think, for the future. We often invite startups to our meetings, and that was the case with Monsenso, a Danish startup that developed a treatment support tool for patients with depression, where you can connect patients with their caregivers and doctors and relatives. And the Healthcare Puzzle Group then developed, based on this app, a holistic care management approach, starting with patient self-assessment and identification of patients, moving towards rehabilitation. And this whole solution is now about to be implemented in several European countries in the next few months. And during our latest network meeting in Hamburg at Philips, we discussed the results of a co-creation challenge, Healthcare 2030, that has been conducted with our partner Hive from Munich. And during the course of the online challenge, more than 85 ideas in the healthcare system, for the healthcare system of 2030, have been submitted and rated by an independent jury. And all the challenges started with several basic subjects that have been identified, for example, lack of skilled healthcare workers, the undersupply in rural areas, healthy aging, and increasing chronic diseases. And the ideas have been clustered in several areas: convenient medication, digital health assistance systems, monitoring solutions, and other data storage and healthcare things, Internet of Things. So a lot of new ideas, and the idea that finally won the prize was autonomous and intelligence patient transport and allocation service. This has been identified as the winning solution. And currently, the Healthcare Puzzle Group developed a concept for bringing this idea to life, but that is an ongoing project, but a very forward-thinking and I think interesting project. The principle of co-creation combined with design thinking approaches for us a strong concept for the development of new digital solutions, especially in the field of healthcare. And Telecom used this type of development approach together with customers and stakeholders, and we took this over to overcome particular interests that are always existing in the German healthcare system. And these particular interests of patients, providers, health insurance, and developers, they managed together to develop a common understanding of the solution. And for example, it started with the overburden bureaucracy of nurses in hospitals, especially, for example, in the field of documentation. And those nurses, they asked for a simple tool that helps them to save time And therefore, a simple IoT button has been developed that can be used for simple tasks like ordering to bring a clean bed from A to B. And recently we discussed with the telecom more complex tasks in the field of documentation or data management, and it's just starting with this simple tool. And these ideas and might have shown that companies and scientific organizations as a group is able to deliver more and better solutions by bringing together different viewpoints on the same healthcare system and using design thinking and co-creation as tools. But before you can work on common projects or support a project of a different company, it is important to generate an open atmosphere of trust and partnership. And finally, you have to agree on some certain rules and common understanding on how to work together in the team of partners from different institutions. And I think it's important that the engagement level of all of the network partners has to be high to develop this kind of open innovation network. And we're hoping to bring this to the next level in the next few months. And hopefully we will have the next meeting together with Uli Weinberg at the Hasso Plattner Institute, or even remote, because I think a lot of cooperation can be done remote. And yeah, that's what I wanted to share about the new healthcare puzzle. Very diverse, open innovation network with big tech companies, small startups, and yeah, that's what I wanted to share. Thank you.
Thank you very much, Klaus, for your insights. If you would go out of your presentation, that would give us a chance to come back to the stage again here. Since we are very good in time right now, I'm just looking if there's any answers from the auditorium yet. I don't see something yet, but that might come up pretty soon. I have a question, actually. I have several questions. I've noted. One is, how do you deal with intellectual property? That is something I'm asked all the time. How do you deal with intellectual property in co-creative situation, in collaborative situation, multidisciplinary teams, and is that an issue at the healthcare puzzle, or is that not? And how do you deal with that?
Yeah, for the time being, there was no issue so far, but it's absolutely important to know that if you're working together, everything that's delivered is owned by all partners. So this might sometimes be a problem, but that's absolutely clear. And the roles and responsibilities have to be clear as well. So if you're in the ideation status, I think that's not that a big problem. But if you're moving into the next status, setting up prototypes and testing them, and then you have finally agree with the partners who wants to own what's delivered here out of this group, for example, or whether you want to share everything that's coming out of the group. So yes, you have to be open and clear with it, but there's no single solution for that. It always has to be agreed together with the partners how they want to proceed and who will own later on the intellectual property, or even the outcome of the project then.
The other question is, I'm just looking, is there any, there's a question from Linda Hickman. How do you find how do you find startups? How do they find you? And that was, I was actually asking the question, how do I become a member as a company?
Yes, yeah, important question. We always have recommendations from the members. They know specific startups, for example, and recommend them. And then we have some kind of a procedure where every partner has a vote to bring in a new partner. And but definitely startups, for example, can approach me or somebody else from the group, or even write us an email on our platform, so that we can then agree on a partnership. You have to bring in something and agree on working together, but yes, we can open up the group as well for other startups, no problem at all.
Yeah, that answers the question of Stefan Joost, who was just asking that, what is the procedure?
Yeah.
And Sandra Wilson is asking, are politics in your networks, which is with the idea to get some solutions, ideas for future decisions? Are there political institutions? So
no, not as a member political. We don't have political institutions as a member. But for example, we discussed openly with the Health Innovation Hub how to cooperate with them. But there's no formal cooperation. But we are open for discussions with every institution that might bring in ideas or supporting this type of cooperation in the network. So yes, we have discussions, example Health Innovation Hub, but we don't have formal memberships of political institutions.
Okay.